So hi all. Yesterday we have seen what is like medical coding and what are the syllabus covered in the medical coding. So I'll just have an overview of yesterday's session. So who can take up the course? Um, like life science graduates and non-life science graduates. Life science in the sense like who are into the stream of biology, zoology, microbiology, biotechnology. So all this will be coming under the category of life science graduates. So my voice is audible and my screen is visible. Please confirm everyone.
Yes, ma'am, you are
Oh,
audible.
okay. So yesterday, like we have seen like who are like eligible for medical coding, and where does a medical coder will work in the MNC's company, nothing but the healthcare companies, and in other countries, like we are going to work in the hospitals, and also nowadays IT companies are also getting the medical coding projects. So we are going to work in the IT companies also. So these are the job locations, and yesterday we have seen like what is medical coding. It is a complete translation of the diagnosis procedures into the ICD and CPT, which is nothing but the alpha numerical codes, and then like how the process will be in the medical coding. So how it will be, how the process will be. First, a patient will visit the hospital where the physician will evaluate the patient and he will document everything. He will document everything in the prescription, and this is converted into the electronic health record where a medical coder will receive it and they will be assigning the codes like this. And then finally, the insurance company will pay the amount to the physicians, because in US and other countries they will not pay directly to the hospital. The insurance will pay the amount. So that is the reason in US and other countries, by birth, they will have the insurance. Okay, so the insurance will pay. And then this process, what we will call means it is nothing but revenue cycle management, RCM cycle. So patient, provider, and the payer, all these three persons are very important in the healthcare industry. So the complete process from where the patient will book an appointment until the final amount is paid to the provider. So this complete process, we will call it as a RCM cycle. And then next, like how the RCM will be. First, the patient will be registered in the hospital. You're able to see my screen, right, everyone? Hello? You're able
Yes,
to see.
ma'am.
Okay. So first the patient will register in the hospital and the insurance will verify it. Uh, the hospital people will verify the insurance, and then the physician will give the service and it is completely converted into the medical codes, and then claim will be processed, and finally the physician will get the amount from the insurance. And then yesterday we have seen like what to learn in the medical coding. You need to learn about the basic medical terminologies, and then ICDs and CPT guidelines you have to know. And you should also know about the HCPCS coding. And like what kind of books we will be using in the medical coding, which is nothing but the CPT book, ICD book, and the HCPCS. And then if you come across, like when you will be in the job, when you will be doing the live coding, you have to use the tools like 3M software, encoder, codify, like this. You have to use the tools. So yesterday I have explained about all these things, right? And then coming to the certification. apart from medical coding training, you should also do the certification. So we have so many certifications like CPC, CCS, COC, CIC, CRC, CPB. So one of the best certifications is CPC certification, because nowadays companies are asking for the certified coders only. So one of the best is CPC, as most of the companies are asking for the CPC certification only. But if like you want to do other certification while you're doing the job also, you can go for the other certifications also. But the foremost important certification is the CPC certification, which is nothing but the Certified Professional Coder. And yesterday we have seen about how the career will be in the medical coding, as nowadays like number of diseases are being increased and we are getting so many projects in the healthcare industry. So all the time the medical coders are required, and there are global opportunities across the world, and there is a high demand, and also the salary growth is also very good in the medical coding. And like we have seen, if AI also comes into the medical coding, it will not impact the jobs, because this is the recession-free industry. All the time hospitals will be there, all the time patients will be going, and the medical coders has to assign it. So even though AI has come, even though it is coding everything, but 5% will be incorrect. So for that 5% also, the human requirement is very, very important. Even though AI is into the picture, no need to worry that jobs are gone. No, it's not like that. Your jobs are secured and safe in the medical coding department. Okay. And then like what kind of job roles will be there in the medical coding means, first will be the entry level, which is nothing but the junior level. Next will be the senior medical coder. Based on your experience, you will be changing your roles also. Next will be the auditor and the TL and the manager. So these are the job roles in the medical coding. So like who have joined today? So myself, I'm Sunitha. I have total of 10 plus years of experience into this medical coding field, and I also worked in companies like Optum, R1RCM, and IKS. So this is about Mima. So yesterday who was not there, and in the today's session, this is about my intro. Now let's come into the topic. And then now, like what kind of salary will be paid in the medical coding means, as an entry level, it will be 16 to 35,000. And then based on like your experience is going on, your salary will be also increased, like 25, 60, and 85, and so on. And if you do the certification from the institute, that is well and good, because if you're doing the certification from institute, you will be well trained, because we will be providing you the structured course, and experienced faculty will be there. So by this, I mean like experienced person, and the structure courses explained in the institute. So the preference will be more for the institute certifications only. Nowadays, most of the companies are also hiring the students, or the persons who have been trained from the institute. The companies are preferring them only. That is the reason I suggest to do the certification from institute only. And then we will be like making you to prepare for the resume, and also we will be like making you prepare for how the interview process will be, how the written exam will be, how the technical and the final discussion, everything we will be conducting like in a mock interview, either in the form of offline or online. And we have so many companies come up in the last 5 to 6, 10 years. So many companies have come up in the medical coding, because as we are getting so many projects. So that is the reason there is a bulk hiring going on all over India, mostly Hyderabad, Chennai, Bangalore, Pune. So here are some of the list of the companies you can go through, like Goro Health, Optum, Teleperformance, AGS Health, Augustus. So many companies have come up. So these are the job locations as I discussed just now: Bangalore, Hyderabad, Chennai, Gurgaon, Mumbai. And also, like, if you want to go to other countries and you want to do medical coding jobs, it is also there in the US, Canada, UK, Australia, but you have to do other certifications. Those country specification certifications will be there. You have to do those certifications. Okay, so this was all about the yesterday's session. And now let's go into the today's session. So today's agenda will be like, you will be knowing how exactly and what exactly you will be learning in the medical coding, and what is the certification, and how the exam will be, and how the pattern of exam will be, and what is the pass percentage. So let's see, like, first, what is medical terminology? So the syllabus covered will be medical terminology, ICD, CPT, and HCPCS. Okay, so first we will see medical terminology. What is medical terminology? So medical terminology is nothing but it is the language used by the physicians. So in the US and other countries, we are working for them, right? So what kind of language the provider is using, we have to understand that. So that training part is given by me only. So you are going to learn about the medical language. It is nothing but a dictionary. See, in English, we have a Oxford dictionary, right? Suppose we are unable to know some meaning, so we will be opening the dictionary and then we will be searching for the particular word. Similarly, here also you're going to learn about the medical language, the language what is used by the doctor. You have to understand that even though you're a life science graduate, but still you should learn the medical language which is used by the doctors, physicians in the hospital or clinics. Okay, so this language is a universal language. So why I'm saying universal means this medical coding is all over. It is in India and it is also in other countries. So whatever the language is used by the doctors, so it is a universal common language and it is a unique language. Why? Why it is important? Because it is the efficient language and it has to be understood by everyone, because we are going to convert into the ICDs and CPTs. Let's take, like, for example, a patient is undergoing some appendectomy surgery. What is appendectomy? See, in the human body, we have appendix, okay, in the abdominal portion. Sometimes this appendix, what will happen means it will get swelling. So that swelling part, we will call it as a inflammation. So whenever this inflammation will have in the appendix, we will call that as a appendicitis. See how many terminologies we are getting here: appendicitis, inflammation. Then how you will understand this language? So that is the reason medical terminology is the first thing you are going to learn in the medical coding training. Okay, so now appendicitis is there. What provider will do? I mean, nothing but the doctor. See, in US and other countries, we will not call doctors. We will be calling them as the physicians. Physicians, providers. Okay. So what provider will do? He will remove this appendix. Now we are calling it as a removal of the appendix. But what provider will call it as appendectomy? What is appendectomy? Ectomy is a removal. What they are removing? Appendix. So removal of appendix. We in generally, as a common man, as a common person, we will be calling, a patient has undergone removal of appendix. But what provider will use the word appendectomy? So that language you have to understand, which is nothing but the removal of the appendix. Okay, so this is one of the example. Like this, we have so many examples. For nose, what we will call in the medical language? A rhino. Okay, for example, in the nose, what happened means inflammation, swelling is there. So what we will call it as rhinitis, which is nothing but inflammation of the nose. Itis is nothing but inflammation. What is rhine now? What is rhine? Nose. So, where is inflammation? In the nose. Next, we can see kidney. What is kidney here in the medical world? What we will call nephro. Nephro is nothing but kidney. For example, there is some swelling in the kidney. What we will call inflammation of the kidney. But what provider will use the language? It is nothing but nephritis. Inflammation of the kidney. Itis is what? Inflammation. What is nephro? Kidney. Okay. Next comes stomach. In generally, we know stomach. But what provider will call it as gastro? Okay. Gastritis. Now, where is inflammation? In the stomach. So, gastritis. Who will use this language, ma'am? Who will use this language? Provider. Okay. So, that is the reason you should know the terminology, medical terminology. Like that, we have so many words like ectomy, otomy, roughy, ostomy. Okay. Ectomy is nothing but a removal. They are removing some organ. What is that organ? Ectomy is removal. Appendix, appendi is nothing but appendix. Okay. Otomy. What is otomy? Cutting. They are cutting in some organ area. Okay. They are cutting at some location. Otomy. Cutting. Otomy is what? Cutting. Like that you have roughy and ostomy also. And remember one thing, this medical terminology is also important for your interview purpose. Why? Because in the interview, some companies will ask the basic medical terminology. Like they will ask, what is rhino? You have to answer nose. What is ectomy? It is nothing but removal. What is otomy? Cutting. So, apart from learning for the CPC exam or medical coding training, but you are also going to learn for the interview purpose also. So you have to do hard work. Okay. So apart from learning, you also need to go prepare for an interview also. Okay. Next comes the ICD coding. What is ICD coding? Yesterday we have seen. Can someone tell me what is ICD coding? What is ICD coding, ma? You don't want to answer? You don't want to answer? What is ICD coding? Someone, please. What is ICD coding? What is ICD coding, ma? You don't want to answer?
International classification of diseases.
Very good. Good. So it is a classification of diseases. So for diseases, we are going to give the codes. Okay. Even though it is wrong also, you have to answer, ma. I want my session to be interactive. Why? Because even though we are online, we are not a face to face, we are online. I want my session to be interactive. Okay, so that you are able to understand or not, I should know it, right? So I want my session to be interactive. If like even though you are seeing wrong, it's not a big issue, you can correct it. I'm here to help you out. Okay. Okay. So ICD coding is nothing but it is the international classification of diseases where we will be assigning the diagnosis for a patient, right? Why this ICD coding is important? Because to track the diseases, this ICD coding is important. Like for example, patient is having some stomach pain, abdominal pain. You are giving a code. So it is for the tracking purpose, like what kind of code you are giving. And also, why it is important? Because the insurance will give the correct amount. Correct billing has to be go to the physician. So it ensures to give the correct payment to the providers. ICD coding is very, very important. And also it improves the healthcare analysis also. Okay, so that is the reason ICD coding is important. Now let us see some examples for ICD coding. For example, patient is having diabetic mellitus and that too it is type 2. So what is the ICD code for that? E level.9. Now for example, patient is having hypertension. What is the ICD code for that? It is I10. And one more thing, ma, who all are listening the session, no need to remember the codes. We have a book for that, which is nothing but ICD book. So from that book itself, you have to give the codes. The only important thing is navigation you have to know. Okay. So no need to remember any codes, but the thing is you should know the navigation and also you should know the guidelines. Okay. And then next, if patient is having pneumonia, we have a code for that, which is nothing but J18.9. Now, if patient is having low back pain, what is the ICD code for that? M54.5. Like that, we have so many diseases and conditions where we will be giving the ICD codes, which is nothing but International Classification of Diseases and Conditions. Very good, who was answered this question. Okay, next. Let's see some examples. Now you have to try this example and I want answers from everyone. Okay, so here we go. The first question is, what is the ICD code for pneumonia? Now let's take patient is having pneumonia. Now you got a report and in that report patient is having pneumonia. You as a medical coder, you have to give a code for that. Now we have option A J18.9 and option B as M54.5. Now all who are listening this session, what is the answer for this? Will you choose option A or will you choose option B? What is the answer, ma? Okay. What about others? What about others? Mahesh, Santosh, Carlos, Satish. What about others, ma? What is the answer? You can try. You don't want to be interactive. You can
Yeah,
try.
option A, ma'am.
Option A, very good. What about others? At least you can message me in the chat box. Option A, okay. Option A. Okay, so it is very clear J18.9, which is nothing but pneumonia. Okay, so similarly, we have other question also. Type 2, you have to give one code, which is nothing but E level.9 and I10. So type 2 is nothing but E level.9. So in this way, you have to assign the ICD codes. Now, we are we have here examples that is okay. But what about the book navigation? You should know the navigation in the book. Now I will show you the book also. So we have ICD book. Okay, so from the book itself, you have to select the ICD code. Okay, so here we go. This is the ICD book where we have, okay, so like this is provided by the AAPC. Okay, so now how you will search the ICD code from the book? So this is same like dictionary only. So it starts with from A. Okay, it starts with A. See, here you can see it is starting with the letter A. Like that you have to go to pneumonia. Now here in this pneumonia means it is starting with what? One second. So in this example, pneumonia, it is starting with P, isn't it? It is starting with P. So if you come across the book, you have to search for P, the letter P. Now let me go to P also. Okay, this is what it is. C. We have to go to P. Okay, see very carefully like how you have to navigate the ICD codes. Okay, this is D. Okay, let me go to P. P, 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 P. Okay, this is E, A, B, C, D, E. MNOP. This is L, MNOP. This is what M. So let me go to P. Yes. See, P. Pneumonia, PN. Again, in that we have to see PN. Okay. Pneumonia, it is there. Yes. So, like this, you have to search for PNE. See, here you can see PNE, starting 3, PNE. This is pneumocystitis. Okay, but we want pneumonia. See, here it is pneumonia. Okay, what is the ICD code for that? J18.9. So, in this way, you have to search for the ICD code in the book. You're able to understand, right? Everyone in the session? You're able to understand, right, how to navigate in the book?
Yes, ma'am.
Perfect. Good. I'm happy you're answering. Okay. So in this way, you have to search the ICD coding. Okay. So this is the navigation part. Now coming to the CPT coding. What is CPT coding? Yesterday I told about this also. What is CPT coding? It is nothing but the surgery coding. Let's take if patient is undergoing some surgery. So for that surgery, you have to give the code. Why this is important? Because it helps in the correct payment for the doctors, and it is the same language which is used globally. Entire world will be using the same language. Okay, and it is helpful for the insurance companies also to give the correct payment. Now let me explain with one example how the CPT coding will be. Here, patient underwent open surgery to remove the gallbladder. Where is the gallbladder? Here, you can see it in the trunk portion. Okay, so now maybe some problem, maybe some cancer growth is there in the gallbladder. That could be the reason to remove the cancer, or maybe some inflammation or some problem is there, some abnormal growth of cells are there. They are removing the cancer. Now here, removal of the gallbladder, what is the medical word we will call? Removal is what? Ectomy. Gallbladder we will call in medical languages coli. Coli. Now, if you combine this coli plus ectomy, cholecystectomy, that is the reason medical terminology, the first thing in the medical coding training syllabus, you have to know. Okay. Okay. Now, for this, you have to give one CPT code. Here we go. The code is 47600 One is cholecystectomy, one is appendectomy. Now, what is the answer here? I want answer from everyone.
Yeah, option A.
Very good. What about others? Okay. So, cholecystectomy option A, you have to select. Okay. So, in this way, you have to rule out the answers. Okay. And apart from ruling out, before that, you are going to learn the concepts. Okay. Next, how you have to navigate in the CPT book. In CPT book, you no need to like navigate like how we have navigated in the ICD. It is you have to navigate with the number wise. CPT book you have to navigate according to the number numerical. Whereas in the ICD you have to navigate alphabetical wise. You're able to understand the difference. ICD, how we have navigated A, B, C, D. But coming to the CPT, how you have to navigate? You have to navigate numerical wise. 10,000, 20,000, 30,000, 40, 50, 60, like that you will be there in the book. Now this is which series we have? 40,000 series. Now you have to go to 40,000 and you have to identify the CPT code 44950. I will show you in the book also for your better understanding. Okay. So this is the CPT book. This is the CPT book we have. Okay. And as we are online, I'll be providing you the this soft copy also. Okay. Now see here how the codes are divided based on the numerical. See, 10,000, 20,000. Did I told or not just now? See, all these are 10,000 codes. Next comes 20,000. 20,000. Now, what is the classification we had in the question? It is 444. Now, let me go to 444. This is also 20,000. Next, we have 30,000. Next, we have 40,000. Why this is divided like this means based on the anatomical location, surgeries are divided. If we take 10,000 series, all these are surgeries related to skin. If we take 20,000, all these are the surgeries for musculoskeletal system. If you take 30,000, it is for the cardiology. If you take 40,000 series, it is for the digestive system surgeries. If you take 50,000 series, it is for the male and female and urinary system surgeries. So like this, the classification is divided in the CPT. Okay, it's okay. Now let me go to the CPT code. What was the code? 44950 and 47600. Let me go to 47600. This is 47600. Okay, this is also 444 You're able to understand, right, how I'm navigating everyone who are listening this session? You're there, everyone, please respond.
Yes, ma'am. Yes, ma'am, I understand.
Okay. So 47600. This is again 47600, 47600. This is 47535, 476. Yes, here it is. Okay. So this is a cholecystectomy code. So in this way, you have to navigate. Okay. So this is the navigation for the CPT. Okay. Now we also have HCPCS, but once you will be joining, once you will be paying the amount and you will be in, I'll be explaining about the HCPCS also. Now let's see, after completing everything, medical coding training, everything is done. Now it's time for your CPC exam. Okay. So in the training itself, you will be learning about the CPC exam only. Whatever you are undergoing the training, it is nothing but medical coding plus CPC certification program, everything. Now, how the CPC exam will be? What is the CPC exam? So, it is the exam conducted by the AAPC. AAPC is nothing but it is the American organization, American Academy. So, it is an organization from the America. So, this organization is conducting the CPC exam. Okay. Why this CPC exam is important? Because nowadays the industries, nothing but the medical coding companies, they want a recognized CPC certified medical coders only, because without any certification, if they are hiring means, or with not only without certification and without medical coding training, if they are hiring means again they have to start from the beginning. So it is very, very difficult for them. It almost takes 1 year to train them. So that is the reason who are well undergone the medical coding training without certification and medical coding training plus certification. So the industry recognize only these people, because if they are getting a project, so they will be hiring a person who are certified coders and medical coding training completed. So that will be easy for them to work. because if they are getting a project, they are working. So it is very, very easy for those persons. They're working the project, right? So it is very, very easy for them. So that is the reason industry is recognizing only for the CPC certified coders and also non-certified, but non-certified also who have completed the medical coding training. Okay. Why? Because they will be having a very good skill in the ICD and CPT. So that is the reason the CPC exam is important for the industry recognition. Now, let me give you some details of the CPC exam. So this is a open book exam. No need to worry. As I told, no need to remember any codes. This is an open book exam and no need to carry any books. Why? Because the exam center, they will be providing you everything. Okay. And then this is the complete pattern of the CPC exam. So just now I have explained, right? 10,000 is nothing but surgeries related to skin. These are the surgeries related to muscles and bones. 30,000 is for the heart. So from each section, you will be getting some questions, which carries for 6 marks. Okay. So from each section, it carries some marks. All together, it will be 100 marks. Okay. So this is the like how many marks you're going to write. Okay. And then how the exam pattern will be. Now here comes a question for so many students, how the exam pattern will be. So it will be in the format of multiple choice question. You're very, very lucky that it is a multiple choice. No fill in the blanks, no matching, nothing. So you will be having 4 options. So out of that, you have to choose only one correct answer. That's it. How the question will be, like patient is having some problem, patient has undergone some surgery. So you have to understand the question and you have to give one answer from those 4 options. So how to rule out that also, I will be giving you the tip. Once you will understand the concept, no need of tip also. In that concepts only, you will be learning everything. Okay. So it is a multiple choice question. Now here you can see how the multiple choice question will be. You'll be getting a question like this, and these are the 4 options. You have to open your CPT book, and from that you have to search the code. You have to go to that code and you have to identify this surgery answer. Just now I have explained, right, how to navigate. The same thing you have to follow in the CPC exam also. Next, what is the pass percentage? Okay, I was like explaining the pattern and everything, how many marks and all. So 100 questions you have to write, that is okay. Madam, what is the pass percentage? Did anyone got this question? What is the pass percentage? No? So the pass percentage is 70%. So out of these 100 questions to get 70%, so how many questions you have to answer correctly? 70 questions you have to give correct answers. Remaining 30 are giving wrong also, no problem. Okay. So 70 questions you have to give correct. So that means out of 100, 70 should be correct. Remaining 30 wrong, no problem. Okay. So 70% is a pass percentage. And next comes like any negative marking will be the question to the most of the students. No negative marking in the CPC exam. No negative marking, no need to worry. No negative marking, nothing. Okay. For example, you are going through the questions. You find any difficulty in any question, you just skip the question and go to the next question. And when you are skipping the question, you have to keep a red flag. All these kind of tips we will be telling before you are writing the exam. Okay. And then you can come back and you can do that again. Okay. Next, how the exam will be. This is not an offline exam. They removed it completely. Previously, like when I wrote this exam, it was completely offline exam. It was completely offline exam. Now it's been changed from COVID time. It's an online exam. Okay. So you will be allotting some center where you have to go and you should write this exam. Okay. And how many hours? So for these 100 questions, you have 4 hours, ma'am. Okay. So 4 hours, in the 4 hours, you have to write the 100 questions. Okay. And then how this exam is been like, how you have to book the exam and all means, the institute will be booking the slots once you are like getting good percentage in the mock exams, and then we will be making you to book the slots, like whenever a date is required for you. Madam, for this date I want to write the exam, I'm very much perfect, and we should also get a think that okay, this person is good to go for writing the exam, then only we will book. Okay. So we will be booking the slots, and once it is done, you will be allotting the center. Same like we are going to write some MSET exam, how we will be getting like in some engineering colleges or schools. Same thing, the CPC exam also, you will be getting the test center where you have to go and write. Okay. So online booking will be there in the APC website. You have to register there, and the slot booking will be there, and test centers will be given to you. Okay. And then once you are a CPC certified coder, you will be getting a certificate like this from APC. Okay. So the APC will be giving you the certificate, and with this, you can good to go for a medical coding job. Okay. So apart from APC certificate, you will be also getting a certificate from our institute, DURGASOFT Solutions. You will be getting the successfully completion medical coding training from the institute also. So you'll be getting 2 certificates. Okay. So this is all about the CPC certification. Now this is all okay, fine, everything is okay. Now what about notes and all those things? So apart from the class, I will be providing you every notes. Okay. See, this is the medical terminology notes. Once the class is done, either I will be sharing the notes or I will be dictating the notes. So this is the notes for the medical terminology, where you will be learning about the root, prefix, suffix, combining form, combining vowel. Okay. So in this, what you are going to learn, what is cardiology? In this, where is the root? In this, where is the suffix? Okay. So this is about the medical terminology. Next comes human anatomy. So we have 11 systems like integumentary, musculo. So each and everything is provided to you. And this is a like info, I mean like a note that once you have joined in this training program, my notes should not be shared to any other persons. Okay. It is a confidential, where it should be with you only. Okay. So here we go. We have integumentary notes. First, I will explain the session, and then I'll be sharing the notes, and also we'll be conducting some exams also. Why? Because for the CPC exam, you have to hard work. You have to do the hard work. So that is the reason, to get a pass percentage in the CPC exam, we will be conducting the mock exams also, because we don't want to take any risk. Okay. And one more thing also, that is, some people, they may not require certification. Only few people will be asking like, we don't want certification, but we want a medical coding training. That is also fine. That's up to your wish. Okay. So this is the notes for the integumentary system. I also have the musculo notes. Okay. So for every session, I'll be sharing the notes also. And ICD. So here we go. We have 22 chapters. Generally, for abdominal pain, chest pain, you will be coding, that is okay. But what about these guidelines? So for some coding, you have to follow the guidelines. Okay. So for example, in HIV, what is HIV? It is nothing but a virus. It is a virus which attacks the immune system. So in this, we have 2 types of coding. So for HIV, we have B20 and Z21. When you have to give B20, when you have to give Z21. So we have to follow certain guidelines like B20 when we have to give means when patient is having HIV and also symptoms, at that time we have to give B20. When patient is having HIV but no symptoms, so at that time we have to give Z21. So that is the reason we have 22 chapters. So all these guidelines I will be explaining and I'll be sharing the notes, and apart from that you also need to keep the effort. When I'm giving my 100% means you have to give me in double. Why? Because to pass the CPC exam and also to crack the job. Okay. So all these 22 chapters are there in the ICT. Next comes the CPT surgery. So all these are the CPT surgeries where I do have the notes and I will be explaining the concepts. Okay. Let me explain one surgery. Okay. So first surgery is integumentary system. So for skin related, we have so many surgeries. One of the surgery is fine needle aspiration. What is fine needle aspiration means? For example, patient is having some mass in the breast. Mass in the breast. So that mass can be benign or malignant. So to know that, they will be doing biopsy. That biopsy, we will call it as a fine needle aspiration. What is biopsy? They will be removing the sample and they will be sending it to the path and laboratory. Okay, that is nothing but biopsy. So one of the biopsies, fine needle aspiration. Okay. So in this, they will remove the sample and they will send it to the path and lab. So in this FNA, you have to follow certain guidelines, like whether they are using any guidance, what type of guidance. What is this guidance means? They will use some scanner like this, which is nothing but ultrasound, because naked eye provider can't see. Sometimes naked eye, they can't see. That is the reason they will be using the scanners. So like ultrasound, CT, okay. So for that, we have the codes. Okay, whether they are using the guidance. If no guidance, you have some codes. If it is guidance, you have some codes. So like this, you will be learning the concepts. How many samples they have removed? You have to count the samples. Okay, so like this, all the guidelines and how you will get a question in the CPC exam, everything will be explained. Okay, so here we go, like what kind of sample question, like what you have understood, you have to practice one question, and I'll be sharing all these things if you are understanding only. Okay. But one more thing, after completing all this, you'll be having some mock exams also. You have to write the mock exams, and the next day I'll be sharing the answers. Okay. And if you are having any doubts, let me ask, let you people have to clarify the doubt with me. Okay. Don't hesitate. If you're hesitating means it is loss for you only, isn't it? So whatever you're having any kind of doubt in the question or in the concepts, you can ask me. Okay. So everything will be concept oriented and knowledge based. Okay. It will be not like blah, blah, blah. So everything will be concept based and knowledgeable. Okay. So this is all about the today's session, and you have any questions, you can ask me. So I'm giving you 5 to 10 minutes. Like you have any questions, you can ask me.
Any exam fees, madam?
What, ma?
Any exam fees?
What exam fees you are asking? Any exam means CPC exam you're asking?
Yes, ma'am.
Okay, so the cost for the CPC exam will be around $800, which is nothing but 75 to 80,000 it will be.
Okay, thanks.
Based on the dollar rate for that day. For example, you are booking today. So sometimes the dollar rate will be changing. Okay.
Okay.
So it cost around 75 to 80,000. Even though you doesn't want CPC certification, you can also take normal general kind of training now. Nowadays, the companies are also hiring non-certified only. It's not mandatory that you have to do certification only. While doing job also, you can do the certification. See, for example, you got a job non-certified. Save some money for certification. Write the exam next year. That is the thing I can suggest. It's not that you have to do compulsory certification. You can learn the concepts even though without certification. But whatever will be covered for certification, everything will be there for non-certification. Both are same, ma. There is no difference between certification, non-certification training. Whatever the amount fees is there, it is for both. Okay?
Okay, ma'am. Thank you.
Okay.
Ma'am,
Yeah,
hello.
Hello.
yeah, tell me.
Uh,
Yeah, tell
can
me.
a 45-year-old do this course and
Ma'am, this
any age
exam
factor?
after completed B pharmacy before CPC exam.
Shravani. Okay, tell me,
Yes,
Shravani, you are
ma'am.
asking something. Can you repeat it again?
CPC exam after completed B pharmacy. Yeah?
No, no. When you are in third year, fourth year also, you can write, ma'am. That is well and good. If you are completing in third year, fourth year only, once you are passed out in 2026, they will be hiring for 2026 passed out. So at the time, your certification will be ready and you will be in job. It's not that after completing B pharmacy, you have to do. No, it's not like that. You can do in the third year, fourth year itself. Why? Because in the third year, fourth year, you're completing the certification. By the time you will be passed out in 2026 or 2027, at that time some requirement is there. We will be like posting the jobs where are the only assistance we will provide. Okay. So we will be posting the jobs. At that time, you can directly go to interview. Your certification is ready for you. And you can also like undergo this training without certification also. Okay.
Okay, ma'am. Thank you.
I do have a doubt, ma'am.
Yeah, tell me.
Can a 40-plus-year-old do the course?
Your qualification,
My qualification is BCom, and I
BCom.
did MBA through distance.
Okay, not an issue. You can do.
Nowadays, companies don't hire 40-plus aged persons. So I was asking if it is feasible.
Okay, Santosh, do you have any like experience in companies and what work
Yes,
you
yes.
have did previously?
I worked in R1 RCM as a medical transcriptionist. I do
Okay.
have 17 to 18 years of experience in medical transcription.
Then it's good. It's good that you are into the R1 RCM medical billing because even my
Medical
some
coding.
colleagues, that's what even some of my previous colleagues also they have done a night shift AR calling medical transcription and they have
Yeah.
learned the certification and now they are into the medical coding. You can do because your profile is very good. I thought like it is some other thing. As your medical transcription person, it's well and good.
Okay. Any age criteria is there? No age criteria.
But you have to go as an experienced person only.
Okay. So, like, do you provide a experience certificate?
Um,
Hello.
yeah, see, as already you have worked in, we won't provide any experience certificate, but as already you are in R1 RCM only, right? You
No,
can
no,
say
not
that
urban RCM. I used to work in R1 RCM. I was terminated there. So now, right now, I am working at AIG Hospital, Pechiboli, as a medical transcriptionist. Hello.
see, okay.
Yeah.
So you are doing medical transcription. It's not an issue. You can do the certification and you can go to other companies saying that I have done the medical coding only. You should not say transcription. You can do.
Okay. There is no age criteria, right?
No. Whatever you have the experience as a medical transcription, so you can keep it as medical coding and age criteria will be there.
Up to what age they will take to jobs? They will
35,
provide.
35 years.
Okay. Then it is not feasible for me.
Yeah, yes, I can
Yes.
say.
Okay. Right. Thank you.
Okay. Still any other questions? And tomorrow onwards, I'll be starting the classes. Starts with the medical terminology class and notes I will be sharing. From tomorrow onwards, the classes will be starting. Okay, Shravani, Santosh, Mahesh, Carlos.
Okay, ma'am.
Carlos, I could see
Okay.
that you are
Thank you.
not talking anything. Can I know?
Thank you,
Hello?
ma'am.
What about this person, Carlos? Hello? Hello?
Yes, ma'am. Tell me.
No, not Santosh. I could see Carlos person has joined, but he's not, he or she, I don't know, not interacting anything. I am driving. Okay. Can I know about your intro? Mahesh, what about you? Can I know about your introduction? I mean, like, what is your qualification and you're from? Because I could see you have joined today itself.
Yes, ma'am. Myself, Mahesh, I completed degree BZC, BSc.
Okay, nice.
I am
BZC means
from,
it's nothing but life science only. Okay, tell
yes,
me.
I am from Kadapa, madam.
Okay.
I completed degree 2022.
2022. Ah, okay, then that's good, not an issue.
Okay,
You can do
that's
the certification and medical coding training. And that too, your good thing is that you are a BZC candidate, which is nothing but I
yes,
think
ma'am.
zoology, botany. It's perfect match for
Yes,
you.
yes.
Okay. So if you like my session, you can join my training program from DurgaSoft Solution, where everything is provided and everything will be concept based and knowledgeable. Okay, so still
Okay,
anything
ma'am.
you required from my side, any questions, so that I can wind up the session. And from tomorrow, I will be starting the classes, medical terminology. When I'm
Okay,
applying.
you can teach only online classes or offline classes.
It is completely online, ma'am. It is completely
Okay,
online.
okay.
If offline, at what time you required?
Uh-huh. Okay, it's okay.
It is completely online.
Okay, ma'am. It's okay. You can teach in Telugu. I can understand easily.
See, English is the language where it's the common
Okay,
universal language.
yes.
Why?
I
Because
understand English, but I understand Telugu easily, ma'am. Okay, I understand English. Okay, not problem.
See, Ma, if for example, I'm explaining some concept, you're unable to understand, you can ask me in Telugu, no problem.
Okay, ma'am.
Okay?
Okay.
Because some people will be from other states. They
Yes,
can't
yes, yes.
understand Telugu. That is the reason we will be teaching everything in
Okay.
English only. Okay?
Okay.
Still you
Okay.
are not
It's not a
understand?
problem.
Okay, fine then.
Okay, ma'am. Thank you.
Okay, ma'am. So from tomorrow, I'll be starting the classes. Okay,
Okay,
starts
ma'am.
with the medical terminology. I think
Okay.
fees and all those things you can query in the front desk. Uh, we have
Okay.
provided the mobile numbers. Please contact them. Okay, for the fees
Okay,
and
ma'am.
everything, fee structure and everything.
How many days this course you will teach?
3 months. 3 months. See, 2 months will be
Okay.
the training, and remaining 1 month will be the mock
Mock test.
exams. Yes, mock exams and all those things. Okay.
Okay. Okay, ma'am. Fine.
Okay, chalo. So this is all about the today's session, and thank you everyone for joining, and I hope whoever have joined yesterday, today, hope so will be continuing the session. So that's all for today. Have a great day. Thank you.
Okay, ma'am. Bye, ma'am.
Okay, bye, ma. Bye, everyone. Bye.